Hi, welcome to this session. Relapsed secondary central nervous system lymphoma remains one of the most challenging frontiers in aggressive B-cell lymphomas. This presentation explores a landmark 2026 Mayo Clinic analysis of 162 patients, which moves beyond traditional clinical metrics to propose a novel anatomical framework for predicting survival and treatment. While the CNS International Prognostic Index is a standard tool, it has a significant shortfall in the relapse setting. Only 21.9% of this cohort was classified as high risk at initial diagnosis. Traditional models fail to capture the distinct biological drivers of different relapse compartments. We must differentiate between localized parenchymal disease and diffuse neural axis involvement in leptomeningeal relapse to truly understand a patient's trajectory. By intersecting anatomical localization with systemic disease status, we identify four distinct subtypes. These range from isolated parenchymal CNS disease, representing 42% of the cohort, to the most aggressive category, leptomeningeal concomitant disease, where the lymphoma is present in both the CSF pathways and systemic organs simultaneously. The survival data is starkly divergent across these groups. Patients with isolated parenchymal disease show a 5-year overall survival of 42.8%. In contrast, those with leptomeningeal concomitant disease face a devastating 0% 5-year survival rate, highlighting that anatomical compartment is the primary driver of patient outcomes. Why is leptomeningeal disease so lethal? It creates a perfect storm of failure. The blood-CSF barrier restricts systemic drugs, while bulky tumor masses obstruct CSF flow, preventing intrathecal therapies from penetrating more than 1 to 2 millimeters into the cancer. This diffuse neural axis involvement makes complete eradication highly improbable with current modalities. We can now identify patients at high risk for this leptomeningeal tropism using specific biomarkers. Double hit or triple hit status, MYC rearrangements, and bone marrow involvement are all significantly associated with homing to the leptomeningeal compartment. Notably, the CNS IPI score and MYD88 mutations do not statistically predict this specific type of involvement. When looking at consolidation therapy, autologous stem cell transplantation shows a massive benefit for treatment-sensitive patients. While unadjusted data shows a 67% reduced hazard for death, a landmark analysis of only those achieving a response shows a meaningful 3-year survival rate of 61.4% for those undergoing ASCT versus 50.9% for those who do not. The clinical blueprint for RS-CNS management is now clear. Step 1. Profile the MYC and BCL6 axis to gauge risk. Step 2. Perform mandatory CSF analysis to rule out occult leptomeningeal disease and stratify the patient within our anatomical matrix. Finally, for treatment-sensitive patients, move aggressively toward ASCT consolidation to secure durable long-term remission. Hope you enjoyed this session. Happy learning!